Hi, I'm Raina Morgan with iHealthTube. We're visiting again with Dr. Flora Stay. She's the author of Secret Gateway to Health, among other books.
Yes.
One on fibromyalgia, which is entitled
The Fibromyalgia Dental Handbook.
Okay, so that sounds like it's pretty inclusive. Tell us, you say that people with fibromyalgia suffer from dry mouth, lots of conditions that they don't connect necessarily with the fibromyalgia that they're experiencing.
Well, let me give you one example. For example, gum disease is a state of chronic inflammation.
Mm-hmm.
And of course we know chronic inflammation is very important if you're suffering from chronic fatigue. But unfortunately, not too many people connect that.
Chronic fatigue and gum disease.
Yes, absolutely.
Wow.
Because now we know that C-reactive protein is an indicator that we can test to see if inflammation exists anywhere in the body.
Okay.
And it's a wonderful way to determine if, as it does exist in the body,
Mm-hmm.
and you go to the dentist and the dentist tells you you have gum disease, to be able to connect the two as far as other organs in the body and overall general health. I can't tell you how many patients I've had that come in that tell me they've had fibromyalgia or chronic fatigue for years, and I do an examination on them, and sure enough, they've got really severe gum disease, and they have no clue, or even the initial stages, which is just what we call gingivitis.
Mm-hmm.
Even the very initial stages of gum disease involves inflammation.
Okay.
So an inflammation, again, just generally makes the body not feel well. And with gum disease, it's present because people ignore it, or they think, well, a little bleeding when I floss or brush, so what?
Right.
So they leave it alone, and this inflammation just continues, and the immune system is trying to combat this inflammation that it recognizes. So
Okay.
it's just going to make that person feel more fatigued, and it leaves the immune system weakened because it's trying to deal with this inflammation in the mouth, when the person really needs their immune support as much as they can to combat these other conditions that are going on. So it's just one more thing that can exacerbate all the other issues that the fibromyalgia has to deal with. So I say this is the entrance to the body, an extremely important organ. Start here as a fibromyalgic and make sure that that area has been addressed, if there's any inflammation, cavities, because once you start and the fibromyalgia continues, it's just going to be worse, and it's going to exacerbate the symptoms.
Okay, well, thank you, Doctor. We will visit with Dr. Flora Stay again.